Hi, my name is Samara Mahindra and I run a healthcare company called Carer. We offer integrative oncology therapies for cancer patients who are going through treatment and post-treatment. What is integrative oncology? Integrative oncology is using non-clinical therapies along with conventional forms of treatment to improve patient and treatment outcomes. What is the problem we face in healthcare today? There is an over-dependency on medical treatment with poor patient outcomes. Cancer is becoming much more of a lifestyle disease. Although a minority of cancer cases is genetic, majority of cancer cases is now lifestyle related. Although we require conventional forms of treatment, we require medical intervention. But if we don't deal with it from the lifestyle perspective as well, if we don't combat the root cause of why the disease happened in the first place, obviously there are major chances of relapse, and that's what's happening today. Allopathic treatment has a very symptomatic approach, and using these non-clinical forms of therapies works very well with the allopathic treatment to provide the patient with a very holistic, comprehensive, end-to-end approach of combating the disease and recovering and healing and rehabilitating from the illness. This is exactly what Carer does. We are actually the first and only company that provides integrative solutions in this comprehensive manner, and we're working with multiple hospitals and doctors around the country to provide these therapies to patients as soon as they have been diagnosed. So when we talk about non-clinical therapies, at Carer what we offer are three major therapies. One is clinical nutrition, second is movement and meditation therapy, and third is mental well-being therapy. Clinical nutrition is offering personalized, customized nutritional interventions to patients based on their lifestyle, their diagnosis, their prognosis, the type of treatment they're on, and is very, very customized to the condition of the patient as they go through treatment and as they recover from the disease. They have access to a clinical nutritionist 24/7, and we are able to combat multiple nutritional deficiencies by being in touch with the patient and working with the patient on an everyday basis. The movement and meditation therapy that we offer with Carer it's an integration of physiotherapy and therapeutic yoga. And the way that we offer this is by managing fatigue, the major physiological side effects of the treatment, pain management, lymphedema, neuropathy, multiple different functional disabilities that can happen with the patient even post-operatively is what we focus on in our movement and meditation therapy. And with mental well-being therapy, we offer this to patients and their family members. It is a support system that is very much required in order to get them in the right state of mind and help them recover through this journey. So Carer as a whole focuses on improving the immunity of the patient, decreasing the side effects of treatment, decreasing the collateral damage that the treatment can be doing for the patient, and putting the patient on the right path to decreasing chances of relapse. Through Carer protocols, we have tested this on multiple patients, multiple patient demographics, different types of cancers, and seen substantial improvements in patients while they're on treatment and post-treatment. These non-clinical therapies are scientific, evidence-based therapies that have been proven to improve the patient and treatment outcomes. Integrative therapies is a well-established way of treatment around the world. Some of the top cancer hospitals in the world have integrative oncology units and integrative therapies, and we need something like this in India. This is when we can see a major change in the way patients are treated and the outcomes of patients as well. The response of Carer and its protocols have encouraged us to offer these kind of therapies to different types of diseases, critical and chronic ailments as well, such as cardiac, neurological cases, neuropathy, nephrology, gastrointestinal cases, morbid obesity, so on and so forth. Integrative therapies is what deals with the root cause of the disease, while the allopathic treatment targets the disease as a symptomatic approach. Combining these two forms of therapies really enables the patient to get a comprehensive solution which is end-to-end, which decreases their chances of relapse and improves the treatment outcome as well. Through Carer, we want to offer integrative therapies and solutions as mainstream treatment all around India and countries like India that don't have access to these kind of therapies. We have seen substantial, phenomenal improvements in patients and their recovery and relapse. And hence, every patient who is going through any type of critical and chronic diseases needs access to these kind of therapies. And through Carer, we're hoping to do the same.